and into a global perspective, I think we would really sit back for a moment and see things a little bit differently. And to me, that really raised so much concern because there's so many people in much more desperate situations. And to me, my first question went on to people who find themselves homeless, people who are finding themselves starving, can't feed their children, have no job, are used to being self-sufficient people, are now thrown into the angst of not being able to do that. So what's going to happen to them emotionally, mentally, and physically?
Yeah. It's really a lot to process. And one of the reasons I wanted to have this discussion is because, you know, we can walk around life with blinders. So just like you've pointed out that North America's got a different experience than somewhere like Lebanon, even within North America. So because of the work that I do, I've had, and you know, the work that you do, lots of interaction with police, first responders.
Yeah.
And in the community, in the hospital that I was working in, that community, there is a street that has several bridges along that street. And in a conversation randomly with a police officer, they were telling us that there's so many jumpers, they don't put it in the news anymore.
No, they can't.
And that floored me because I actually was thinking it was that there wasn't a lot of people doing this, but it's that it's not reportable because they don't want to report on, or not reportable, they don't want to report on the number of times this stuff happens.
And the fear around that, Natasha, has always been, and look, suicides have been happening for thousands and thousands of years. Actually, we lose a person to suicide every 40 seconds around the world.
Wow.
And we lose 11 Canadians a day to suicide. Last year, we lost an officer almost every 2 days in the United States.
Oh.
So the numbers are staggering, and that's before COVID. And sorry, you were saying about, sorry, just go back to your point again, because there was something I wanted to address there.
The fact that there's way more suicides happening and they're not
reporting it.
And the fear. So we could be walking through life with these blinders thinking that not a lot of people are responding in this way to their pain.
Right. And they downplay it or don't report it. Number one, because there's a shame associated around it. You know, the family's going through enough as well, but they don't want copycats. They don't want, they think there's a potential contagious effect around suicide. Right. So that's why it's really not talked about, and hence that stigma. But I really think if we can talk about, again, how the suicidal mind itself, the thoughts of suicide are not, you know, indicative of a pathology or not indicative of weakness or being a bad person or somehow weak, then that opens the door to conversations that can prevent the actual act of suicide. The act of suicide is tragedy. It is for that person. It is for their family. It is for everyone and anyone they're connected to. So the idea is we need to prevent it. And how do we prevent it? We talk about it. Yeah. And we give people a forum, a platform, a place, a safe space to talk about what is happening that is perhaps causing these types of thoughts.
Yeah. Yeah. I think, and even just like how you talked about the language shifting from social distancing to physical distancing, we've seen the language shift with suicide. We used to refer to as committing suicide. Well, you commit a crime. And so that just speaks to the stigma when you classify it as if it's a crime. And now we talk about dying by suicide. And just that shift in language alone shows we're trying to open the understanding and not demonize this thing that is about pain. And sometimes, like you said, the thoughts can exist without there being accompanying actions. Correct. But it's just very interesting how fear and stigma and other things shadow how we interact with this phenomena. And we want to be able to get people to understand that it's not contagious. you're not going to make somebody do it if you actually have a conversation. And it's okay to do things like tell me more.
Absolutely, absolutely. And before I came up with "Tell Me More," and actually it was funny. "Tell Me More" came up in a conversation with a friend, and she's like, "Oh my gosh, that's so good. That's something. That's a tool right there."
Right.
So that was really interesting how it came up, and it's because we were talking about suicide.
Mm-hmm.
And so things happen sort of very organically, and the tool of cause for pause, it has the same sort of evolution. Cause for pause actually came from a very personal experience where my husband is a firefighter and had been diagnosed with PTS 3 years ago, and in the height of everything he was going through, found himself contemplating suicide and contemplating suicide. Now, just imagine he's not understanding what's going on in his body and in his brain, because things in his words were going haywire. He was having nightmares. He was having flashbacks. He was reliving the terror that he had seen and had been part of, over and over again. He didn't know how to turn it off. And on top of that, his aggravation had gone up, where he was, probably getting angry at us more than he wanted to and more intensely. So then there was the guilt and shame of that, compounded on top of those nightmares and visuals that he was having. He was having the smells of the call coming back to him. So it was just a very overwhelming time, and he couldn't take it anymore. He was tired. He couldn't sleep, and this had gone on for weeks and months. And, he was disconnecting from us because we couldn't understand what he was going through. And he couldn't tell us because he didn't have the words and didn't understand what was happening. So instead, he was going very much inward and found himself very alone, helpless, and hopeless, because it didn't look like this was going to end. So he found himself in a position where he was contemplating suicide. And when he came home, I could see that something had changed and something was different. And so we started a conversation. And he openly told me, he goes, "I was looking at that pole and I was wondering how fast I would have to go." And I said, essentially, tell me more. I started asking questions, let him talk, because I didn't know in that moment what was the right thing to say. So I just allowed him to talk instead. And also then followed up with the question was, well, what was your cause for pause? So when you're in that moment and you're looking down that tunnel, what was the thing that caused you to say, wait a minute? What was that thing that caused you to just pause? And he said it was you and the kids. And I said, okay. And then I said, you know what? I said, your cause for pause is very noble. Mine was not that noble. And that's where I started to open up to him and tell him, I've been there. I was looking down that same tunnel at one point in time. And my cause for pause, like I said, was not as noble. It was, what if I screw up?
Wow.
Like it was just utter fear of not doing it right. And it doesn't really matter what your cause for pause is. It's it's the reason you choose to live. It's the reasons for you to choose life. It's the reason that's going to buy you 5 more minutes, 5 more hours, 5 more days, whatever it is. And I think it's absolutely essential for all of us to have cause for pause conversations. That means with your mother, your father, your brother, your sister, anyone you love, your friends, your coworkers, everybody. Just imagine if we could, Natasha, sit over a cup of coffee and say, we're all going through rough times right now. And some of us are going to find ourselves in really dark situations. But if you ever found yourself, Natasha, in that dark situation like that, what would be your cause for pause? What would be your reason for living? And you tell me, Natasha, I'm going to do it right here, right now with you live. Natasha, what is your cause for pause?
Oh, my list is long. My list is
Well,
Jesus. My list is family. My list is friends. My list is what I've been called to do in this world that I haven't done yet.
beautiful,
But
beautiful.
what's beautiful is having these discussions.
Yes. And so now listen, Natasha, there's more than just you and me sitting here listening to what your cause for pauses are, okay? There's a whole list of people out there who have now heard what your reasons for living are, what your causes and pause are. But most importantly, Natasha, your brain has heard and has now connected your cause for pause, your reasons for living with each and every one of those things. So can you, for a moment, repeat your cause for pauses so your brain hears you loud and clear?
So I said my cause for pause is Jesus, my family, my friends, and all the things that I was called to do in this world that I haven't done yet.
Beautiful. And the many times that you have opportunity to say that out loud so your brain hears you, God forbid if you ever found yourself in a situation where you were feeling very dark and lonely, what's your brain going to do?
It's going to remember.
It's going to remember your cause for pause and start listing them for you.
Yeah.
So it is essential that we have these kinds of conversations because
it.
there's a neuroscience behind it where our brains start to get rewired and associate thoughts of suicide with our cause for pauses.
Mm-hmm.
And when we can associate the two, we have another tool in our prevention toolkit.
Yeah. I think that's beautiful. I'm like, I want to pause, but I'm like, we got to keep talking. But it's such an amazing way to connect with what you have inside of you that is your reason to be, right? Or, you know, what is your reason to be? And all those pieces, how does that help drive you? Because the beautiful thing about it too is using those to get you past that most painful moment, that when you can start to breathe, because sometimes in our pain, we feel like we're being choked and we can't breathe. Right. So when we get to the point where we feel like we can breathe again, there's often relief that we have not done this thing that crossed our minds. And so I love that ability to help people tap into their cause for pause and the repetition, because you are having your mind hear it so that it's easier to access in those moments when you need it the most. I love that.
Absolutely. And it's really important that not only the people around you, the people you care about and love, know what your cause for pause is, because obviously we're your support system and we're here for you and we love you. But many of us, when we're in those moments of darkness, we have tended already to sort of isolate ourselves or alienate ourselves, or when we're looking down that dark tunnel, we find ourselves alone. And so the people that need or would say something to us and remind us aren't going to be there. So we need to have those positive triggers in our brain embedded so that they fire when we need them to. And that's what the sort of the neuroscience behind the language is and things like that. So again, if we can, you know, thoughts of suicide, connect them to our cause for pauses, really helps us at that time have another prevention tool with us, even when no one's around.
Mm-hmm. I'm just loving it. It's such a great thing to do. And it might sound very simplistic to people, but it really is so powerful in that being able to look at that thing that can keep you going in those moments where you feel like you can't keep going. And what's great is you can frame it around having the discussion. So the discussion isn't about, are you thinking about suicide or are you at risk for suicide? And you can still reinforce what might come up when those moments come, if they come.
That's right. And actually, it's not a shameful conversation.
No, it's not.
Because your cause for pause may be in a context of suicide, but really what it's translating to is, what's your reasons for living?
Absolutely.
And so in nowhere in that is a negative connotation, right? And like I said, you know, it's a nice catchy little phrase, cause for pause. And it's there because, like I said, I want to establish it as a neuro trigger for people when they are in crisis. But essentially, we don't need to shy away from that conversation, because that's what we're talking about. We're talking about a person identifying every reason they have to live. And Natasha, I would love to have that coffee with you, because, you know, sure, but way back when, you know, my cause for pause was not as noble, but let me tell you, over the decades, it's grown. It's grown. And so we evolve and we change. And like I said, it bought 5 minutes, it bought 5 days, it bought 5 years, and it's bought 5 decades, right?
Right.
Oh God, I'm not 50 yet.
You know what? I didn't even catch that. Yes, no, you're not 50. Just for the audience's knowledge, she's not.
That's
50.
right. That's right.
You're thinking, girls, you look good for 50
I'm
plus.
20 at heart, baby.
Good anyways, but you are not 50. You know, it's interesting because I find it much, and this might sound a bit disturbing, but I find this much more comfortable a discussion in the context of my work. So I go into work and I put my mental health hat on, and I can have conversation after conversation after conversation. What would I do if it was in my personal life? I would still have the conversation,
yeah,
but it would be harder. And I've had two interesting experiences. So I had one experience where it wasn't anybody in front of me, but I was in a coffee shop, and at the next table overheard the two girls basically through reading text messages that indicated that they were dealing with somebody who was having these thoughts. And I thought, is it intrusive to go intervene? But I didn't know, would they know how to handle it? So after some hemming and hawing and being a bit uncomfortable, I finally walked up and I'm like, hi, ladies, I'm really sorry. I overheard your conversation. I'm a mental health professional, and I just want to offer any support if you need it. Turns out they were both social work students, which is why somebody reached out to one of them, because they knew that they already had that context, and they knew, they're like, nope, we've got this in place and this, and they were like able to rat off all kinds of great things to do. But I told them, I said, I was worried about being intrusive, but I couldn't not intervene. I couldn't take the chance that maybe you two then felt you had no options to support this person who wasn't even there, right? So that was one interesting, that one was more uncomfortable, but I actually had a personal experience where I was really stressed out. And a lovely, lovely lady I worked with when I was working at Markham Stouffville Hospital, when I said to her, like, I am so stressed, I just can't take this, not paying attention to my language. And so she said to me, she goes, are you at risk of harming yourself? Are you thinking about ending your life? And it jolted me, because I was like, no. But I, as a professional and as somebody who knows there was pure love behind it, was just like, thank you for being brave enough to say that to me. I said, you have nothing to worry about. There is no risk. That has not even crossed my mind. And I've had moments in my life where it has crossed my mind. But I said, it's not even on the table. It's not in the vicinity. But I appreciate you standing out probably of your comfort zone to bring it up to check.
absolutely.
And I hope that more of us can do that in these moments where we might think something they said doesn't sit well with me, and I feel like I need to check. Because it's not always somebody coming to you and saying, Sajel, I want to end my life. I feel suicidal.
Right. And so that's
hidden between the words that makes you think, is that risk there?
Right. And kind of just to address the point that you brought up around, you know, the clinical setting versus everyday life. You know, there's a lot of tools and strategies that we have as clinicians. However, we're not clinicians 24/7. I know we like to think that we can be, but reality is I'm a mom, I'm a wife, I'm, you know, a daughter and a sister and a friend. And, you know, so I encounter these things in my personal life more than I'd like to admit, but it does happen. And that's why the tools like Tell Me More and Cause for Pause are not clinical terms at all. Like, we want to be able to create an environment or create that comfort to be able to have these conversations, like I said, over coffee.
Yeah.
Right. And why not? Like, if you know, there's nothing that has ever stopped me from going up to somebody that looks like they're in distress and sparking up that conversation. Mm-hmm. There has been nothing that has stopped me from going up to somebody who looks like they're having the time of their life and sparking up a conversation.
Mm-hmm.
And this is where that sort of philosophy around human connection and high quality connections really comes in. We think about having these conversations, with people that we're very either close to or intimate, or perhaps shame keeps us from doing that, and we'd rather have them with total strangers. But either way, the conversations are good to have.
Right.
And that's where sort of like I want to draw the attention to people, like, we think that having these deep, deep conversations only have a place with people who know us, love us, and we have that security with. Well, you know what? I'm going to challenge you a little bit and say, you know what? Nothing wrong with having a deep conversation with somebody who's a new friend, or perhaps an acquaintance, or someone you've just met. Because here's the reality of it. We're all humans, and this is such a natural component to the human condition. We're all, can I swear on this show? Like, use shit? Is that okay? Yeah, okay.
You have to pay. You put money in the jar later.
Oh, okay. But we all go through shit, basically. Right. Life is not, rainbows and roses all the time. So people, if we are brave enough to kind of come forward and talk about the not so pretty things, we are then taking the shame away from it. We are making it more open and more comfortable for people to come forward. My parents, like, just because you do this work, why do you have to go and share all your stories? Right?
Because it's a different generation. You keep all your business private.
Right. And there's a level of shame. Yes. And I said, no. I said, the reason that I share my stories is so people understand that I can connect. I can empathize. I get it. And it's such a powerful, powerful tool. We are getting our everyday heroes coming forward and now sharing the fact that they can't take it. They can't bear it all, because people like myself, other people in uniforms, other heroes are coming forward and saying, yes, this is part of the human experience. This is part of the human condition. And this is normal. But why can't we talk about it?